And joining me now is the Secretary of Health and Human Services, Alex Azar. Secretary Azar, welcome to Meet the Press. And let me start with just a simple first question. Why are we failing in the fight against COVID-19 when so much of the rest of the world seems to be succeeding right now?
Well, Chuck, let's talk about what we know, which is that we're seeing surging in cases in counties, especially in the southern parts of the United States. We've gotten reports from our governors that the majority of the positive cases we're seeing are age 35 and under. A large number of those are going to be asymptomatic. We've got our fatality rates and our hospitalization rates are the lowest they've been in 2 months, but this is a very serious situation. What are we doing about it? We're surging in working with our local authorities and states. This is a county by county issue. So getting in there and getting to the bottom of why we're seeing cases surging. And then in addition to the traditional contact tracing, what we're doing now is we've got to test entire communities, find all positive cases, because this is a very different virus with this asymptomatic spreading. Get every positive case, get those people isolated. We've got hospital capacity in all of these areas. We have personal protective equipment, and we're going to be there to back them up. We now have treatments. We've got steroids, remdesivir, convalescent plasma. And I encourage your listeners, if you've had COVID, call your blood bank, American Red Cross, and please donate plasma to increase our supplies. So we've got the tools to do this. We just did this in the last couple of weeks in North Carolina, but the window is closing. We have to act, and people as individuals have to act responsibly. We need to social distance. We need to wear our face coverings if we're in settings where we can't social distance, particularly in these hot zones.
Well, let me ask you this. Did we blow it during the first shutdown? The first shutdown was designed, I thought, to do three things. Get our testing capacity up, provide some relief for hospitals, and make sure we have hospitalization capacity up. And one of the big things was contact tracing. And so it seems pretty obvious what happened here if you just looking back at a layman. You guys put out guidelines in April about what it would take for a state to open up. No state followed those guidelines at all. Some states followed them okay, pretty closely, or came to close. But a lot of the states in the South didn't do it at all. And a bunch of them don't have contact tracers. Isn't that why we're here?
So, Chuck, this isn't about reopening or not reopening. We've got many communities and states that are just as reopened as these southern states but aren't experiencing this. We've got to get to the bottom of why we're seeing these cases surge in this area. But at its core, we all own as individuals our individual behavior to make sure that we are practicing appropriate social distancing and wearing facial covering when we're not able to, and practicing good personal hygiene, and especially protecting our most vulnerable citizens. But, you know, Dr. Birx and Dr. Fauci talked about this at our press briefing on Friday, that one of the bedeviling things about this virus is the asymptomatic spread of it, which means the traditional contact tracing of public health that our local authorities are so used to is a necessary but not sufficient protection. We've got to do that. But it can't just be sitting in a public health office making phone calls. We've got to get into the community. We've got to get dust on the boots. We've got to find the people and test entire communities to get our positive cases. That's the type of action we've seen in North Carolina, and that's what we need in these other local communities.
But, Mr. Secretary, I still don't understand why we don't have enough contact tracers. The head of the CDC said we have less than 100,000 nationwide. We should have 300,000, some experts have thought. And again, we've been at this 5 months now. Why don't we have enough physical contact tracers in these southern states?
Well, Chuck, these states have to build up their contact tracers, but they've also just got to build up getting into the states, getting out into these counties, into these local communities. It's a very community-based effort at this point. So we've surged people into every one of these states. We're working with them on the ground, but it's about getting out, working with NGOs, working with trusted community leaders, getting testing done, getting people isolated. But it's important to remember we now have many more tools than we had months ago to deal with this. We have therapeutics. We're on the road to vaccines. We have personal protective equipment. And again, I'd say any hospital, nursing home that needs anything, be sure your governor's office knows. We'll get that into FEMA, and we'll make sure we're there to support you.
I asked the governor of Arkansas, Republican Asa Hutchinson, if his job would be made easier to get his community, get his state to wear masks. If the president, He doesn't have to wear one. If he would just say it, just tweet it. Here was his response to me, sir.
A consistent national message supporting the importance of wearing a mask and social distancing is very important to making sure everybody understands the importance of it. Nothing beats leadership.
Mr. Secretary, multiple times with me in our 7 minutes so far that we've talked, you've brought up masks, you brought up social distancing. But without the President of the United States doing this, how's half the country going to listen? Have you directly asked the President to please ask the country to wear a mask?
So I'm the President's Secretary of Health. I'm telling you, practice social distancing. Where you can't appropriately social distance, we encourage you to wear a facial covering. The Vice President of the United States on Friday stood on stage, walked up on stage wearing a mask, even though he doesn't need to, in the sense that everybody around him is tested. He's in a bubble. The President, we know, is a very unique circumstance as leader of the free world. He's tested constantly, and those around him are tested constantly and are kept at a distance even with that. But we're all saying this. The President's guidelines for reopening, the President's guidelines, his guidelines have said from day one, practice social distancing. If you can't, wear face coverings, practice appropriate personal hygiene, and always, please consider your individual circumstances and those of your household members. Protect the most vulnerable, those over 80, those over 65 with 3 or more of the serious comorbid conditions. These are the people we have to ring fence and protect right now.
It's a do. What you just articulated, Mr. Secretary, is a do as I say, not as I do. The President of the United States holding indoor rallies twice in the last 10 days, once in a state that is seeing a potential of an out-of-control spread in Arizona. He doesn't talk about wearing a mask, and you avoided my question about whether you've asked the President to at least ask the country to wear a mask. Just because you put guidelines under his name, when he doesn't do it, his people don't listen.
Well, Chuck, I'm not going to talk about politics, but we've seen mass gatherings over the last several weeks with people rightly expressing First Amendment and political views, and this is appropriate. But my message is one of public health, which is if you're going to participate in any type of large gathering, I encourage you, consider your individual circumstance, consider the circumstance of those you live with, and take appropriate precautions that are appropriate to yourself and your community.
Secretary Azar, I have to leave it there. Appreciate you coming on and sharing the administration's perspective.
Thank you, Chuck.
Hello from Washington. I'm Chuck Todd, and thanks for checking out the Meet the Press channel on YouTube. Click on the button down here to subscribe and click over here to watch the latest interviews, highlights, and other digital exclusives.